initially a lot of the recommendations really focused on, trying to mitigate spread, the importance of so the importance of hygiene, importance of isolation, tracing, and things like that. But what was interesting was when this was first coming out, it was almost as if all you really had to do was take on these healthy, hygienic habits in order to prevent the spread. And it was made, and it was, and this might not have been the complete intention, but it did have this way of individualizing responsibility for something that is actually much bigger. What that did was it was focusing again on these technical solutions to a problem that's not actually a technical problem. And it's a problem that is global, and it's also very political in the sense, in terms of how do we decide where we want to allocate resources, and what do we actually prioritize? System preparedness, it's actually, again, like you both mentioned, it's laying out a lot of these broader structural inequalities and social inequalities that manifest themselves, but it's also reminding us how human life is actually valued, and to what extent it's actually not valued in this larger, broader economic system. One of the main things with the Paris Protocol is the items for the dual use items. So there are lots of items that are actually banned from entering either the West Bank or the Gaza Strip, and a lot of those items are necessary if you're talking about manufacturing or development, even in terms of like the capacity of the health system. So for example, so one of the main things in terms of the health system, and specifically with any equipment, that any radiotherapy equipment is banned from entering the West Bank or Gaza, because of this argument that it can be used in ways that threaten Israel's security. But what that means is that it also further binds the Palestinian health system, and then also the same for pharmaceuticals in terms of like certain raw materials and others are not made available. So what you're doing essentially is you're actually putting a cap in terms of how the health system can develop, and how local manufacturing can also develop in a way that meets the needs of the health system. And what that does is that it increases the dependence of the Palestinian health system on the Israeli services. And if you actually look at how things are spent within the health system, more than 30% of the costs or annual expenditures within the health system go to referrals outside of the Palestinian Ministry of Health, and primarily for curative care. And the biggest item there is oncology services. And those either go to East Jerusalem hospitals or to Israeli hospitals. And Israeli hospitals, it's also at a much higher price. So even though they constitute about 17% of all referrals, it's about 34% of expenditures on referrals. And so so you're limiting the potential of the health system to develop, but then also binding it. And then the other thing related to also is the permit system, and like the different classification of administrative zones. And what that does also is it limits the capacity of the health system to function as a coherent whole. And when you have to rely on permits, what you end up having there are delays in getting things in. Things are left at the port that have to be approved by Israel. So there are all sorts of shortages and delays within the health system stemming from this economic arrangement. And it actually feeds back into the Israeli economy.